All right, let's dive right into this explainer. Today, we're mapping out the complete patient journey of COVID-19, starting from a microscopic infection all the way to full physical rehabilitation. We're going to look really closely at exactly what this disease is, how it functions inside the human body, and most importantly, how medical science and active recovery protocols are actually used to fight it. To help us wrap our heads around all this efficiently, we'll follow a clear roadmap. 1. Anatomy of an infection. 2. Recognizing the symptoms. 3. Diagnosis and treatment. 4. The road to recovery. And 5. Prevention and moving forward.
Section 1. Anatomy of an infection. How the virus invades.
So how does this virus actually get inside us? Well, SARS-CoV-2 doesn't just bump into our cells and magically phase through them. No, it is actively hunting for a very specific doorway. It's called the ACE2 receptor. You can think of it kind of like a lock and key mechanism, and it's located right there in our respiratory tract. Once the virus finds that exact keyhole, it unlocks the cell, slips inside, and, well, the infection officially begins. But hey, before it even reaches those receptors, it's gotta travel, right? It primarily spreads through respiratory droplets and fine airborne aerosols. Every time an infected person coughs, sneezes, or even just speaks, they are literally launching these microscopic viral vehicles right into the air. And this is exactly why poorly ventilated indoor spaces or crowded environments are just prime real estate for transmission. The virus just hangs out in the air, basically waiting to be inhaled through your nose, mouth, or eyes.
Okay, so what happens next? Once it actually breaches our defenses, this crazy step-by-step biological sequence kicks off. After it enters and attaches to those ACE2 receptors in stages 1 and 2, the virus literally hijacks the cell in stage 3 to copy itself. This massive explosion of new viruses triggers stage 4, which is immune system activation. Inflammation begins. By stage 5, this inflammation hits the tiny air sacs in our lungs, the alveoli, causing fluid to build up and severely decreasing gas exchange. That brings us to stage 6, the critical crossroads. From here, it's either progression into respiratory failure or the start of recovery. Moving on to section 2, recognizing the symptoms, knowing the warning signs. Now let's shift from the microscopic level to the human level. The absolutely crucial thing here is knowing exactly when you should just stay home and rest versus when you need to rush out and get urgent medical help. Standard symptoms like a dry cough, losing your taste or smell, fatigue, muscle aches, they're highly uncomfortable, sure, but usually manageable at home. But then you have the severe, urgent symptoms. If a patient is dealing with severe shortness of breath, sudden confusion, persistent chest pain, or a bluish tint to their lips or face, which is called cyanosis and means oxygen is critically low, they need emergency medical attention right away, no waiting around. It's also incredibly important to understand who is most vulnerable here. The virus totally exploits pre-existing vulnerabilities. If you're over 65 or dealing with heart disease, diabetes, chronic lung or kidney issues, obesity, or a weakened immune system, the risk of the disease getting severe skyrockets. Because of these conditions, the body's ability to handle that huge inflammatory response is compromised, making the whole battle significantly harder. And even after that initial infection clears out, we've still got to be on high alert for long COVID or post-COVID condition. This isn't just feeling a little tired after a winter cold. We're talking about symptoms like intense brain fog, severe shortness of breath, muscle weakness, and extreme persistent fatigue that can hang around for weeks or even months. It severely impacts a person's daily life, bringing on reduced exercise tolerance, intense joint pain, and even anxiety and sleep disturbances long after the virus itself is gone. Section 3. Diagnosis and treatment. Clinical interventions. So, once those symptoms are recognized, we enter the clinical phase. To figure out exactly what's going on, the medical team goes way beyond those standard rapid tests. They're using PCR tests, which are the gold standard for detecting viral genetics. They use CT scans to spot specific patterns of lung inflammation, continuous pulse oximetry to track oxygen saturation, and comprehensive blood tests to check inflammatory markers like CRP, D-dimer, and ferritin. Essentially, they are constantly tracking exactly what the virus is doing inside the body. And depending on what those diagnostic tools actually find, treatments escalate in a highly structured, tiered approach. Mild illness? That leans on supportive care, like rest, hydration, good nutrition, and fever control using paracetamol. But the second a patient transitions to moderate or severe illness, doctors have to step it up. They deploy oxygen therapy, corticosteroids to fight back against the massive inflammation, and targeted antiviral medications. Then, at the critical tier, if respiratory failure sets in, we're looking at hospital admission, ICU care, and mechanical ventilation to take over the physical work of breathing so the lungs can just try to heal.
Now, I really want to clear up a super common misconception right now. Antibiotics are not effective against viruses like COVID-19, period. COVID-19 is caused by SARS-CoV-2, which is a virus. Antibiotics only kill bacteria. So throwing antibiotics at a purely viral infection literally does nothing to cure it, and doing it unnecessarily just fuels global antibiotic resistance. Doctors only utilize them if they can actively confirm that a secondary bacterial pneumonia has developed on top of the viral infection.
Without that timely intervention we just talked about, things can go south fast. The virus can trigger devastating systemic complications that extend way beyond the lungs. We aren't just talking about a bad cough here. This profound immune response can trigger acute respiratory distress syndrome, COVID-19 pneumonia, deadly blood clots known as pulmonary embolisms, heart inflammation, and ultimately multi-organ failure and sepsis. It really underscores just how severe this disease can be. Let's move to Section 4, the road to recovery, empowering rehabilitation. But the story really doesn't end with medical treatment. Recovery from severe COVID-19 is absolutely not passive. Early mobilization and targeted physiotherapy are vital, active processes to restore exercise capacity, reduce breathlessness, and improve patient quality of life post-infection. You don't just lay in a hospital bed and wait for your lungs to magically fix themselves. Once you're clinically stable, you have to actively train your body to function properly again. To do that, healthcare professionals use some very specific targeted exercises. Physiotherapists guide patients through diaphragmatic and pursed lip breathing to literally retrain the lungs to take in oxygen efficiently. They use thoracic expansion exercises, kick off early walking programs, and progressively build right up to aerobic and strength training. It's a rigorous pulmonary rehabilitation process, and it proves that active rehab is just as critical as the initial medical care to get a patient's independence back. Finally, Section 5. Prevention and moving forward, protecting the community. Zooming back out for a second, how do we apply all this medical knowledge to actually protect ourselves and our communities moving forward? Well, these core prevention strategies are our absolute best defense. Vaccination is right at the top because it dramatically prepares your immune system ahead of time to reduce severe illness. But it works in tandem with practical daily habits. Good hand and respiratory hygiene, improving indoor airflow so aerosols don't stick around, wearing masks in high-risk or crowded settings, and just maintaining a healthy baseline lifestyle, diet, exercise, sleep, to keep your immune system sharp. And if we compare COVID-19 to other respiratory illnesses like the flu or the common cold, you can really see the vastly different threats they pose. The common cold, generally mild, mostly giving you sinus congestion. The flu, that can definitely be severe and lead to things like pneumonia, but COVID-19 brings life-threatening, unique systemic threats like ARDS, long COVID, and severe blood clots. They are fundamentally different viruses requiring fundamentally different levels of respect and prevention. So, wrapping up this explainer, I want to leave you with this thought. Knowing how deeply this virus can impact absolutely everything, from our microscopic cellular biology all the way to our long-term physical mobility, how will you adapt your daily habits to protect your own health and actively support the vulnerable members of your community? The science is clear, and the rehabilitation strategies are proven, but the daily choices in prevention, well, those belong to all of us.